Good morning.
Good morning.
Good morning, Philip. My name is Dr. Jovanovic.
Nice to meet you.
Well, you too. Welcome to our dental center.
Thank you.
And I have seen and I've heard that you've been referred for a problem you have. So I'm going to ask you a few questions so we both understand a little bit what your needs are and what your chief complaint is.
Okay.
So first of all, you're missing one tooth?
Yes, my front right canine tooth. In the process of getting braces, basically my baby tooth on the right side never fell out.
Oh.
So they discovered that it was ankylosed. So basically the oral surgeon went up and took
the
it
canine
out.
out. And how long ago was that?
I'm thinking September.
So it's about 5 months ago, 6 months ago?
Yep.
Okay. Well, do you have any, let's say, contraindications potentially? Do you have any problems? Heart, kidney, liver?
No.
Nothing? Are you taking any medications?
No.
Nothing?
No.
Any allergies?
No.
Nothing? You're clean, healthy as it could be?
I am.
Good. So, Fielden, like from my standpoint, you know, like you're healthy medically. You're very clear in your dental needs. So you already have gone through the different options. So you've already, like, you know, in your mind already you're decided and clear what an implant can do for you. So your chief complaint is very obvious. You know, you need a replacement of that tooth. Dentally, you're clean. You're very hygienic. You have a very good health in your mouth. So all that looks good. I'm quite happy with what I'm hearing. So what I want to do now is like look at, of course, the condition in your mouth, so I can see what it really is.
Sure.
And then once I put that together with all the things we just talked about now, we hopefully can give you a positive plan to treat this tooth with an implant.
Great.
Okay?
Yep.
Let's have a look at what we have here today. So we took the CT scan and we can see the condition. Here the occlusal view, the vertical, the adjacent teeth, and then here the cross section. So let me take some measurements. We're lining up everything correctly. You can see here the little reference point to where the tooth is. We want to have the exactly through the middle. Also here, the middle of the site and the middle of the occlusal side of the bone. So it all looks good. So let me take some measurements. First of all, height. You should have more than enough bone. So you can see here, that's the 21 millimeters. So we have enough. Let's take the width. 7 millimeters. So that should be enough for a regular platform. And then he has here a dip, as we can see, a pretty severe concavity. Can you see this? So a pretty severe concavity, 4.1. So this part, we might have to put like a little bone graft in this area. The implant should be able to be placed quite nicely at the top, but right here, the tip, we might need a little bit of bone graft. So let me measure one more thing to where the concavity starts, which is here, 9. So at approximately 9 millimeters, the dip starts. So I need to come in with the implant a little bit more palatal so we can circumvent this little dip. Welcome back.
Thank you.
So today is our second appointment, and I have some good news for you.
Great.
To discuss, and have some details with you as well to discuss. So we took last time the CT scan. Mm-hmm. We have good sufficient bone at the top of the crest. Okay. So where basically your final crown is going to be meeting the gums. There's enough bone. Then more higher up, it gets a little bit narrow. It's thick enough to place an implant, but I probably will need a bone graft there. Okay, so that is something which is not unusual that this needs to happen, but in your case, we need to definitely do it. Okay.
Is there a specific kind of implant that I need or that you're going to be using for my particular case?
Yeah, that's a good question, because we have a lot of different implant systems and different implant types. Okay. So we use the Noble Biocare implant system, which has basically the longest documentation on implants in the field. Okay. So that's basically where the field started. And all the implants have really a very long-term research and data to support it. Then the implant type we use is a special one as well, which is tapered, so it fits the bone very nicely. Also in that area where you're like a little bit more narrow. And then at the crest of the bone, the neck is specially prepared that it again gets a little bit more narrow, so it preserves the gum line better. Okay. So basically this implant type was designed to stabilize itself the best possible way in the bone, plus to preserve the gums where the crown is being placed. Okay. So it will have the best possibilities for aesthetics. Okay. Yeah. Any other questions?
No, that's it. Thank you.
Good. So what we'll do then is the staff will prepare you with all the medications and everything, and then we're pretty much ready to go for the surgical placement of the implant. Okay. Okay? Yeah. So at this moment we're going to be analyzing all the information we have gathered from the patient. First of all, we have here the model, and as we can see, he is a normal occlusion, normal tooth position. I can see that that's all will be a positive situation for our treatment. I'll go now to the upper jaw, and specifically what I want to see is the width we have, and you can see the space we have between the two teeth is approximately 8 to 9 millimeters, starting from the gingival crest all the way to the incisal edge. So knowing that our plan is to place a regular platform implant, we'll have at least 2 millimeters on either side to place the implant. We can look at the occlusal. Also here you can see a nice contour the patient has. Nice contour. So the bone is existing here nicely, and the gingival tissue is existing nicely, so that should be good. Then let's look at the interocclusal space. So how much distance does he really have for us to place the abutment and the crown? And you can see that as well here. That looks good. We've got plenty of room there. So more than 7 millimeters from the gingival crest. So that will be plus bone will be 2 to 3. So we're going to have close to 10 millimeters of bone to occlusion of the opposing tooth, so that's good too. Let's then take the next step, and that is we're going to look at the X-ray, and we're going to be focusing here on the Panorex first. Looking at the general condition of the oral cavity, it looks all good. Stable periodontium. I don't see any endodontic problem. Here we see the area of concern, no endodontic problems, and all positive. So we focus here on the small area, which is the tooth position which we're missing. We're going to go here to the left, and you can see the periapical X-ray, which shows me a slightly enlarged periodontal ligament on the central incisor. That might be of something to do with the orthodontic movement. Then the crest of bone is excellent. You can see there's no vertical loss. From the papilla height to the papilla height, it's crossing over. So that means our bone is fantastic. It's really good. And the quality looks good. The premolar also looks good. So we're in good condition here. That looks good. And then we move here to the CT scan, and this we already saw on the screen. This is just a printout. And again, we see a beautiful amount of bone between the two teeth, no vertical dip whatsoever. So from a vertical level, we're very good. Then we go to the cross section. You can see again at the crest level sufficient bone to place the implant. Here's the reference point to where the tooth is, the little round radial opacity here. And then we go to the middle section of the jaw, and that's where you see it gets a little bit narrow, just about 4 millimeters, which we're hitting. So that's the area where we might need to do a bone graft. And the height is more than enough. We got 2 centimeters. With all the information we have gathered, which you see here, the study models, the x-rays, the CT scan, the clinical examination I have, the implant which we have chosen for the patient is the Replace RP, so 4.3 by 13 conical connection. And obviously the conical connection will be good for the patient because he's very concerned about aesthetics, so this will really provide the maximum amount of bone preservation and a maximum amount of gingival preservation. And then the tapered part of the implant, of course, will be good for him because it's tapering down in that area where he's getting a little bit narrow, and that will also minimize the amount of bone graft that the patient will need. Here we have the different abutments which we have chosen. There's like different ones. These are all stock Procera aesthetic abutments with the conical connection, and they will allow us to just choose the right one for the shape of his gingival tissue. And you can see like just we have different sizes. So we'll choose that, of course, depending on the conditions we're finding intraorally after we place it into the site as well as after the impression. So these are all different sizes which we have. And here you can see the different ones. So we have 4 different ones to choose from, which just give us a good option. And then we have here an impression copings. We'll use here either open tray or a closed tray. In this particular case, we'll use an open tray impression. We've already prepared a custom tray, which will allow us to make a very precise impression, so everything is really done at the optimal precision as this patient needs. Also already we have made an shell for this patient. You can see here the little shell of the canine we made, and this one will be retrofitted to the modification of the abutment, which will be done in the laboratory. And then as a final, we have here the surgical stent, which is in position on the posterior teeth, as you can see. And we're following the contours of this canine in the same fashion that we're following the contour on the contralateral. So we're really trying to duplicate the length of this tooth. So we're going to position the gingival line exactly where the lateral incisor is in relationship to that. And you can see here that the gingival line on the canine is about 1 millimeter more apical than the lateral incisor. So we're going to follow that as well here on this particular area. So you can see that here. So that looks good. And I probably have more than enough bone here, as you can see, to place that implant, especially if you look at the lateral, where the gingiva is on the lateral, I can go a little bit deeper to make that canine longer so it replicates the same level as you can see here. So I can go about 1 millimeter deeper than the lateral incisor. So that's very, very good. It's very beneficial from a standpoint of surgical implant placement. Okay, so we seem to be all good and ready to go with this patient.
For more education programs, visit the Guide Institute at www.guidedental.com.